NEA Baptist announced they successfully implanted a cardiac contractility modulation device, or CCM. The local hospital is the first in the state of Arkansas to successfully complete the procedure. Macy Davis has the latest.
New technology for heart failure, making it easier for doctors to help patients.
I said, well, you just do whatever you got to do. I said, just don't let me die.
Jimmy Cook is a patient at NEA Baptist. He was the first patient in Arkansas to receive a new implant called a cardiac contractility modulation, or CCM device. It's a milestone both Cook and the doctor who performed it were excited to talk about.
Last year I was in the hospital there like 6 or 7 times with shortness of breath and things like that.
Cook went to the hospital with a heart attack in 2016. Since then, he's been back to the hospital several times for blockages and trouble breathing. Last year, Dr. Matthew Haustein, Cook's cardiologist at NEA Baptist, asked Cook if he wanted to try out the CCM.
He said, you'll be my first one. I said, well, you're going to use me as a guinea pig. And he said, no. He said, I think it will help you a lot. To be honest with you, I think he's the reason I'm still alive here today talking to you.
The CCM is designed to improve heart contractions in patients with heart failure. It does this by shooting electrical pulses to heart cells.
It can improve the ability of the heart muscle function. It can improve their heart's ability to squeeze. It's been, more and more studies are coming out which are showing a lot of favorable data, including, potentially keeping people out of the hospital more. It's similar to a pacemaker that we insert inside the body.
The CCM was installed on January 16th, and Cook is already feeling pretty good.
My breathing, my shortness of breath hadn't been like it was before I had this,
Dr. Haustein excited to see his patient reacting well so far.
He did very well, and he's a patient who had been in and out of the hospital multiple times, and since we put this device in, so far hasn't been back in the hospital yet.
This device, just an example of how much cardiovascular technology has changed, even over the past 20 years.
We have so many new things now available that we didn't have before. It's made a huge difference in the lives of our patients.
He said time will tell how beneficial the CCM is. He added that there's always new technology to keep track of.
We're constantly going places to learn new things, to train on new devices, on new technology, new medications, especially in the field of cardiology. It seems like it's an evolving, world all the time.
Cook said he'll keep trying out new technology if it's recommended, especially if it helps people like him suffering from heart disease.
They telling me all the time about different stuff they're experimenting with and this, that, and the other. So, hey, maybe I'm one of them they're using to experiment with. I don't know, But if they're going to experiment with me and get me better, just keep doing it.
Reporting in Jonesboro, Macy Davis, K8 News.